Should we be overly concerned that the numbers appear to be absolutely rocketing at the moment?
I think numbers are probably peaking around now, so I suspect probably they'll start to fall during April as we have our Easter holidays and people perhaps mix a bit less more indoors. I think we should be cautious but not over anxious. Although numbers are very high in terms of cases, number of deaths and hospital admissions remain fairly low compared to previous waves. So vaccines are working well in keeping down the serious cases and the deaths. So yes, be cautious, but don't be over anxious about the current numbers.
And yet, I mean, we are told that people are still dying of COVID or being very, very ill with COVID. Not many, I understand. But does that mean that they are those? Do we know what variant those people who are suffering have caught? And so is the one that we really shouldn't be worried about too much, the Omicron?
We're facing Omicron largely at the moment across the UK. There's now a new variant of Omicron that's appeared in the last month or two, something called BA2, which appears more infectious than the original Omicron variants, but not more serious in terms of the disease it causes. So that's also driving numbers up, the fact we've got this slightly more infectious variant, but it doesn't appear to be more serious, as I mentioned, than the previous variant we faced quite recently.
So it's a case then, is it, as far as you're concerned, from a professional perspective, that we do, as we're being told, need to learn to live with this?
I think we have to learn to live with the virus. That doesn't mean doing nothing, though. We have got vaccines, which work very well in stopping serious illness and death. We can also, as the weather improves, mix more outdoors rather than indoors, and also improve indoor ventilation as well as the weather gets a bit warmer. So there are things we can do. So yes, live with the virus, but that doesn't mean doing nothing. It means, taking vaccination offers and also improving ventilation, and perhaps trying to mix more outdoors, over the spring and summer to reduce the risks to ourselves and our relatives.